everyone, and thank you for joining us today. I'd really like to thank you for taking the time out of your busy schedule. I know that time is precious for everyone. We know that this is a very challenging time for people, and as we navigate through our experience with the COVID-19 pandemic, many people are struggling to adjust physically, psychologically, emotionally, and even financially to the sudden and widespread changes that have occurred. Uncertainty and change can threaten our sense of security, which is a basic need for most people, a basic human need for most people. It results in increased stress, especially when this change is sudden and when it's forced upon us, and even more so when so many of us are involved. It's a hard time for nearly everyone, and it can be even more challenging for people who live with mental illness. As a leader or manager in your organization, you may be feeling the effects yourself, or you may be seeing it in your staff. And while there are a lot of great resources available with tips on how to maintain mental well-being during a pandemic, as a leader or a manager, you might be wondering what you and your organization in particular should do to support your staff as we move through this time of uncertainty and change, so that they can do well in the workplace and at home. And the purpose of this session is to help you with some of those questions. My name is Liz Horvath. I'm the manager of the Workplace Mental Health Program in Opening Minds at the Mental Health Commission of Canada. And I've been helping organizations to implement management systems and help them with health and safety and workplace mental health for nearly 25 years. And I'm here today with Martine Oliveira, VP of Employer and Client Services at AGS Rehab Solutions. AGS was one of the 40 organizations that participated in the Mental Health Commission of Canada's case study of organizations that implemented the national standard. Martine has over 20 years of experience in the field of vocational rehabilitation and disability management. Her career started with frontline mental health work, and her passion for mental health has persisted throughout the years, making her the perfect fit to join AGS's reputable executive team in 2017. She is a certified disability management professional and a consensus-based disability management auditor with a reputation for upholding best practice approaches in the work that she and her teams provide. In addition, Martine also finds time to teach at the York Seneca Rehabilitation Services Program, where she has shared her passion for rehabilitation and disability management as an instructor for over 11 years. Martine is also a certified mental health first aid instructor and VP of Employer and Client Services at AGS Rehab Solutions Inc, where she works closely with an extensive interdisciplinary team providing proactive and client-centric services related to stay at work and return to work disability management and rehabilitation initiatives. If you have any questions after watching this presentation, please feel free to contact us. Our contact information will be provided at the end. So just before I invite Martine to join in on the discussion, there's a few points that I'd like to cover. So this is what we're going to be talking about today. We'll be looking at the relationship between uncertainty and stress and the effect that it has on mental health and on your business outcomes. And we're going to have a discussion about how leaders and managers can support the mental health of needs of your workers throughout the changes that lie ahead. So we can take some of our learning from some of the research on emergencies and disasters that have occurred. There's not a great amount of research on the mental health impacts, but there are some. And I want to start off by mentioning that all of the mental health impacts are not necessarily negative. While there's a lot of talk about the fact that there may be an increase or a spike in mental health conditions throughout and following this pandemic, what we do see from some of the research is that some of the positive effects are things like a boost in morale and confidence when people come together and they respond well. There is definitely a new appreciation for life. People tend to grow and they experience greater emotional maturity as they navigate through these hard times. And there's definitely greater compassion, sympathy, and understanding for people who are in difficult circumstances. So, really, what we're seeing is the human spirit coming to life. When people get together and they work through these things, we really see a growing of the human spirit. Now, the studies do show that when people go through emergencies and disasters, there are some potential negative effects as well. Things like shock, helplessness, worry, fear, even guilt at maybe not doing a better job, or what could I have done to prevent something from happening. People get very fatigued and exhausted, especially those who may be working on the front lines, or even those who are working in the background. But people who are off work as well because of, their business having to shut down, they may also be experiencing these feelings. And so we have to remember that it's not just people who are on the front lines who are struggling. It is, it's quite widespread through our through society. We definitely see things like distress in caretakers. There's increases in depression and anxiety, especially after someone has experienced an infection. We do see increased rates of depression in someone who's gone through an infection. And certainly for those who are out there doing certain work, there is an increase in the risk of post-traumatic stress disorder. So we do have to be aware of these things. For some, there may also be issues with vicarious trauma or secondary trauma, which can be from hearing stories or watching the news, or just being on media, or due to the nature of their job where they're having to support others who have gone through those traumatic experiences. It can really be an issue. So yes, there are positive effects. There are also negative effects. And our purpose here is not to focus on the negative effects, but to focus on what can we do to help to reduce the risk of negative effects and improve our ability to stay healthy or to get back into being healthy. And I'll show you what I mean by that. When we go through stress, there are certain areas of the brain that are affected. So generally, we have our higher functions in the top part of our brain, what we call those higher brain functions that we see in the frontal lobe and even in the temporal lobe of the brain. Areas of thinking, speaking, reasoning, and problem solving are all contained in that prefrontal cortex. Memories, hearing, behavior, and generating emotions are in this area here. So when we're able to think clearly, when stress is within a reasonable control, we are able to enjoy those higher brain functions at an optimal level. When we get really stressed, or when we are experiencing a threat or a danger, the amygdala gets fired up. Now you can't see the amygdala here. It's buried deep within the brain. But the amygdala is where we get that fight or flight response from. And when that takes over, it kind of pulls from those higher functions, and it makes it more difficult for people to make decisions. It makes it more difficult to express yourself. It makes it more difficult to problem solve. Now, a lot of people say, I work really, really well under pressure, and that's fine. A lot of people do work well under pressure. But when pressure is prolonged and we're experiencing chronic stress, it can really take a toll on those higher functions. And so when we think about it, with so many jobs that rely on those higher functions, we need to do whatever we can to help employees through this time with us, to reduce the amount of chronic stress that they're experiencing. So the idea isn't that there's no stress. We know that we can't eliminate all stress, and not all stress is bad for us. We do know that a certain amount of stress allows us to operate at what we call peak performance, where we're energetic. We may feel tired at the end of the day, but we're not into that area of total exhaustion. The idea is that if we can help people to maintain their stress in that optimal area, that we'll be able to do great work, we'll be able to manage our balance, we'll be able to enjoy our lives. And this is more challenging as we're going through times of uncertainty and change, and certainly as we're navigating this pandemic, because the future looks a little uncertain. We don't know kind of what's going on, and we have never had to navigate something so widespread in most of our lives at this time. So we really have to look at what are those signs and symptoms or indicators that might be showing that a person is feeling overstressed or overpressured. Things like indecisiveness, fuzzy-mindedness, exhaustion, increasing irritability, increasing anxiousness. Because the thing is, we don't want people to burn out. And it's not just about work. It's about the fact that people are struggling at home as well as we're going through this with so many different things that they're having to deal with. So I want to draw your attention to the indicators that you might see. So if for those of you who have taken the Working Mind training, you will be very familiar with this, and mental health first aid. And you can, and you'll know that, there's this continuum. We are all along this continuum somewhere between being mentally healthy or mentally ill, and it can fluctuate at certain times of our lives. So the idea is to be aware of those indicators of what could be declining mental health and know what to do to help bring people back into the green or the healthy area. What we want to do from an occupational health and safety point of view as well is to prevent people from becoming injured or ill. So if we are able to put things in place, processes, procedures, training, interpersonal communications that will help to keep people in the green, then we can also take some of the burden off of the healthcare system and those clinical mental health services, because we can actually do things in the workplace to help keep people healthy and safe. So that's what we're going to talk about today. As I welcome Martine in, what we're going to be talking about is some of how we can use the National Standard of Canada to help guide you through this. So in the National Standard of Canada, we have identified 14 workplace factors. You may be used to hearing people talk about 13 workplace factors. There's actually a 14th called other chronic stressors. And that's where employees may identify specific chronic stressors that are applicable to their industry or their organization or their particular job. And we've seen that within, for example, healthcare and paramedic services that have identified additional chronic stressors like exposure to traumatic situations, frequent exposure to traumatic situations, and working alone, for example. So as we go through this interview, we're going to be hitting on many of these workplace factors, and I think you'll hear them as we go through this interview. And I'd like you to think about, in your organization, whether you're essential services and continuing to work, or whether you're starting to think about how do I bring my workers back to work who have been off because of emergency restrictions, or perhaps you're starting up a new business. It's very important to think about the mental health of workers as you start to move forward. Even as we go beyond lifting the restrictions. I mean, if you're listening to this recording and we're, a year into it or beyond, we still have to be thinking about how the mental health of workers is being impacted by change and uncertainty. And this can really help to guide you through. So welcome, Martine.
Thanks, Liz.
I'm so excited to have you here with me today. And, you and I have known each other for quite a long time now. We've done a fair amount of work together in the past. And, I just think that you are a beautiful human being. I love the work that you do. I love the passion that you bring to it. And I'm so excited to do this interview with you today and share the knowledge, the great knowledge that you have with anyone who is listening. So I'd like to invite you to elaborate a little bit on your background and your experience and what it is that really draws you to this work.
Oh, well, thank you, Liz, for such a lovely introduction, and right back at you. I think, that we share that passion for, mental health and understanding what that means to overall well-being and to being a productive member of society and be able to navigate our lives with fulfillment. So, that really is what drives me in this work, is that just very core understanding of the need for people to feel functional and to be able to live their best lives. When I graduated from the York Seneca Rehab program, you know um, it was an undergrad in psychology, and it was all about what motivates people to return to function. That was always the question, in my mind. Where are they, where do they need to be, and how are they going to get there? And that question of how they'll get to where they need to be, that rehab process, that recovery process, that return to function, has been the long lasting question that really started this journey, I think, for me. I was exposed to mental illness really early in life. My uncle lived with schizophrenia, and I saw the impacts of that on my grandmother, on my family, on my mother, on all of us. And my mother also struggled with mental health issues and throughout her life. So early on, I was exposed, and that started my journey on human behavior and really understanding that. And trying to figure out, what helped people stay resilient and well. And of course, we've all had our own lived experiences. Anyone who says they haven't had lived experience in mental health, I wonder about how much insight they might have, because I think we all have lived experience in terms of mental health issues, not necessarily mental illness, but definitely mental health issues. And then I, started to work early on in my career, my first 5 years at Progress Place, which is this incredible organization, which I know Liz, that offers psychosocial rehabilitation services to people living with chronic persistent mental illness. And what I learned there in those 5 years about the human spirit, about how much people just want to be a part of a community and to be functional and work, well, that's carried me. That's resonated and stayed with me in everything I do. And when I started working in disability management, I kept reflecting on what I had seen in terms of people living with chronic persistent mental illness and their desire and need to stay part of a community, to be part of a community, and to work and have some feeling of productivity. And so it was always very interesting to me as I, got more and more involved in disability management and workplace disability management, understanding what it was that was actually keeping people from recovering in a lot of situations when it wasn't, organic illness, when it was, psychosocial factors, and how that impacted their well-being and perception ability, which in turn created disability. And then, of course, joining AGS in 2018 was, a natural progression for me. I was doing for her organization, and in terms of promoting mental health and the need for the impacts of supporting teams and the workplace to create psychologically safe spaces for people to feel connected to their work and to be productive. And so my journey just continued from there. And then I became a mental health first aid trainer. And the collections of stories that I've gathered about human resilience, human spirit, living with mental illness, dealing with mental health issues. That's just continued to inform me and my practice in disability management as I lead my team, as I work with employers in helping them to navigate disability management in their workplace.
Mm-hmm, mm-hmm. Thank you for that. It's so obvious that this is just so much more than just a job to you. It's really part of who you are, and that's just beautiful.
Yeah.
So let's jump into the first question that I have for you, which is really, what are you seeing out there? And what are you hearing in terms of mental health needs for workers, including people in managerial roles?
Yeah, I mean, it's just a lot, right? There's a lot of information, but us, in dealing with the employers we're dealing with, it's been a really interesting experience. Of course, there are varied concerns and challenges depending on the industries that we're dealing with. For example, of course, the obvious one is for healthcare workers and the fatigue, the physical, the emotional fatigue, the vicarious trauma, like you've mentioned, the fatigue just related even to compassion, the compassion fatigue. And then, just very generally for all sectors and just irrespective or unrelated to the actual industry, we're seeing generally an increase of symptoms related to anxiety, depression, OCD for people who already were living with these conditions but managing fairly well. This new situation has just really triggered a lot of symptoms that they were managing before. And for a lot of people, it's new. It's new symptoms of anxiety that may translate into depression or new symptoms of depression. There is just so much uncertainty that is really festering for people. And that really is creating that. I know that Mental Health Research Canada has recently reported they're expecting to see or already seeing a 5 to 20% increase in mental health issues since this pandemic started. And I suspect those are conservative numbers, right? It's just the tip of the iceberg right now. And we're going to see a lot more short-term and long-term durations for disability are going to be extended because people living with chronic medical conditions, which we already know very often are comorbidities with mental health issues, again, that's going to be exacerbated. So what might have started off as something less complex in a recovery is going to become, compounded by the mental health issues, which will in turn, potentially extend those or increase the need for accommodations. So employers are dealing with all of that. Of course, the financial implications for employees, the uncertainty of knowing, is their job going to continue to be available? How is their company the organization they're working with being impacted? How is their role going to be impacted? All of these health scares, financial concerns, the feelings of isolation for people who are not able to socially interact the way they did before with their coworkers, with their family and friends, of course. The makeshift workspaces are creating unique challenges ergonomically, but also, again, that lack of being able to, turn your chair or walk over into an office, or, if it's in the industry of manufacturing, we're seeing really unique situations where people who at one time, already struggled with shift work. I think we know a lot of shift work in other fields, not just manufacturing. Now with everyone, more people at home who maybe aren't essential workers, who are either working from home or off completely, the noise levels, the ability to sleep, the unrest of the mind. And we all know, the circadian system needs that restorative sleep for us to function, and how much that will impact mental health as well. Then there's the stacked duties that people are dealing with. So for those people who are working, not only are they working, I don't know how many posts I've seen and employees we've talked with who are going off or who are afraid to return because they've been off because of the stacked duties. They've got kids at home. Some of them have kids and elderly parents to support. How are they going to manage to now also deal with workplace demands, especially with demanding workplaces? So there's the fear of loss of productivity, inability to cope with the demands of work. All of these things are really compounding what we're seeing in terms of workplace issues.
Yeah, I think it makes a difference, the type of workplace that they're working at. Like you said, different types of workplaces. They can't all work from home.
No.
It's not all computer work where we can just be connected virtually. There's people that do a lot of hands-on work.
Yes.
And if the schools aren't back in or the daycares aren't back in, that really puts people at a loss too. And because of the social restrictions that we've had, those physical restrictions, people can't necessarily rely on the grandparents to do the babysitting. And we still have all of these considerations. I think one of the other things too that I've seen out there a lot is, and you mentioned the issues around comorbidity, and that people may be dealing with other chronic diseases or other chronic illnesses or even chronic pain from previous accidents, for example, and how that plays into it. I was reading an article just this morning about the difficulty that people are having, that there's increased risk for people who are afraid to go to the hospital right now because they're afraid of getting an infection. So their underlying conditions are getting worse. And by the time they do go to the hospital, they're in a really bad state. So this is something I think that employers need to think about as well, is that it's not just the risk of COVID-19 itself. It's not just the risk of infection that people are dealing with. It's the full impacts of what we're dealing with, and the amount of uncertainty that adds to people, because the more uncertainty we have, the higher the stress levels. And like I said, we have to try and help people through that. So these are some really unique situations. There's really a need for clear leadership at this time, so that employees understand, what are the requirements, and what are our managers and our leaders not only requiring from us, but what are they doing to help us and support us through this time. And we talk about, for example, just going back to the workplace factors. There's a lot of talk about what we need to do as far as protecting people when they go back to work. This is one of the workplace factors, being protection of physical safety. But what we need to understand with protection of physical safety is that we're protecting the physical and psychological health of workers from hazards within the physical environment. And when people don't feel safe in their workplace, then there's a psychological impact to that. And so as we navigate through this time, we have to make sure and do things like providing personal protective equipment, thinking about how are we going to do that, physical spacing at work. Are people going to be allowed to use the kitchen at work? What are the cleaning protocols? How do we prevent infection? But then there's other things that come into it as well, as far as use of personal protective equipment beyond just infection prevention and control. How do we make sure that our protective equipment is cleaned and sanitized? And then there's that whole aspect of working with chemicals. I saw yesterday another news report that there's an increase in poisonings from chemical disinfectants, from people mixing things or just having more exposure to them. So we have to also make sure that our employees are protected from that, whether they're using those chemicals in the workplace, but even providing information if they're doing work from home. So that's just one of the factors. What are some of the other mental health considerations that leaders and managers need to be aware of as we navigate this strange new world that we're going through?
There's so much, and you raised so many, of course, of issues. And what I want to say is that, with all of those concerns about protective equipment, about physical distancing, all of these things is again that looming anxiety that employees are dealing with. Especially those who have, for example, elder parents at home who they have to return home to if they're going into the workplace, and the exposure that they're bringing home with them. I mean, it's just so significant. And I think, you mentioned about the role of leaders, which is so significant and also so daunting. Always, leaders have such an important role, but it really does strike me right now in terms of how much they're impacted. Managers are overwhelmed. We're getting calls from managers and HRs who we work with, asking us just to kind of go over a situation with them. They're not sure how to have conversations, what to ask for. Are they going to ask for too much? Are they going to upset people? So, we're asking a lot of from management right now. We want them to be calm and optimistic, of course, cautiously optimistic. And we want them to also be able to provide clear leadership and direction. Well, that's a really tall order because they themselves may be also struggling with things that their teams are struggling with. And so, and they have their pressures from their upper leaders as well for productivity and, organizations more than ever are trying to stay afloat. Many of them significantly compromised. So there's those stressors that may come out, right? Dealing with those competing priorities, this can be really challenging. And frankly, management historically has not always, the majority of management has gotten into the positions they have because they were, subject matter experts, or because they did really well, in terms of their productivity and knowing how to do their job, and because of seniority, but not because necessarily they knew how to manage people and have difficult conversations with people and provide clear direction and leadership that keeps people connected. And yet this is what we need now more than ever. And certainly the factors of the standards speak to this so well. And I remember being so excited in 2014 when I saw those, and I thought, oh, this is just a matter of time before government and employers adopt this as a requirement. I mean, we pay so much attention to physical. We've done so well with managing physical health and safety, and yet knowing that mental health is the number one disability, which will continue to increase exponentially now with this, the stressors that we're dealing with COVID. And it's not mandated. It's recommended. It's best practice, but and there's still not even enough employers aware about it. So more than ever, I think it's such a good resource tool for employers who are struggling. We mentioned that there are more employees now asking for an accommodation to either be absent or work from home, and they're not qualifying for short-term disability because they're not functionally disabled from doing their job. But they may have these underlying medical conditions that before didn't limit them from doing their job. But now, the use of public transit may be a big scare. The use, not enough physical distancing, the risk in the workplace, for them may be higher than the general population and other employees. So employers are grappling with that as well. Are they going to bring employees in and hazard, what can become a WSIB claim, or a WCB claim, right? So if somebody can, legitimately link their catching and contracting the virus in the workplace as a direct result of that, it's going to be hard. And I'm sure that, the different boards are going to look at those cases, individually. But there is that fear, and employers are concerned about that, about bringing these employees back who then might go off and it becomes a claim and more challenging. Yet if these employees stay off and it's not a short-term disability claim, what is it? How are they going to pay for that? Do they apply for CERB? Do they apply for EI? All of those questions that managers are grappling with while they're dealing with everything else. It is a tall order for management. So
let me just ask you a question there before you go on, Martine. So when employers are dealing with this situation where an employee may be at higher risk, but it's not a compensable functional limitation at the time, we want to prevent those employees from being injured, whether it's physically or psychologically, right? So what would you suggest that employers should be doing to help those employees? Should they be asking them to self-identify? What kinds of conversations would you suggest should happen? And if the employer isn't able to have those conversations, who should they be looking to outside of the workplace who might be able to help them with those conversations?
Yeah. So, it's going to be, again, different for every workplace. You got to think about your workplace culture, what has worked historically with your employees. So it's going to be different and unique for each employer. But I would say having open discussions about the concerns that are surfacing, that are new, that never existed before, that's a good place to start. Encouraging people to reach out and identifying who in the organization is the right person for them to reach out to, so people know who they can feel comfortable to reach out to and have that permission to do that. That's really important. And then you may get those self-identifications of people who self-identify with their concern, and then address it on a case-by-case basis. That's going to be really I think the best strategy for most employers to start with. With some of the really large national organizations, they put processes in place. We got organizations who, one large organization who contacted us because their short-term disability insurance provider was not able to address for them these cases of people who had self-identified as requiring an accommodation to either work from home or be off because they're at such significant risk, and they're considered essential workers. And so the employer and their team, their return to work specialists, they simply did not have the ability to address all of the cases. I think, there were almost 100 cases to review. So we got on board and swiftly started reviewing those, talking. So, it's a call, an actual conversation with each employee to really understand and appreciate what's going on. Then there's the issue of, not being able, we don't want to tax the medical system. We're not going to be asking for long medical reports right now, which also impacts the return to work planning in a lot of cases. We want to be able to be agile. So employers can work with disability management providers and identify people in their organization who may have that ability to help them through that. But a lot of time it involves employees talking about things that are really personal to them. And that's not something necessarily you want an HR team to be dealing with, because we know that can be really tricky in the long term. So it's really looking at what resources do you have, making the communication, opening up that communication, acknowledging these concerns, and and really encouraging employees to reach out if they have concerns, and letting them know that every case will be looked at on a case-by-case basis, because everything's so unique. It's going to be hard to say that there's a formula that this plus this equals that. you want a process. You want people to know that, if you have a concern, this is who you call, this is what will happen. But the outcome and how it's going to be managed really is going to need to be looked at individually, on a case-by-case basis.
Mm-hmm. Thank you. And one of the things that we've seen from the research, the bit of research that's there on previous smaller pandemics like SARS and Ebola, is that when people are going through these types of things, they generally will need continued mental health support. And sometimes the support that we're offering, it may be good for the time being, but then they don't have enough follow-up. So important to really look at it from that case by case. Thank you for going down that road with me. Yeah. So when it comes to really trying to figure out how do we help people move through this, what are some of the other things? I mean, we see things like it's not just the exposure to the virus that may be causing the increased fear or anxiety. There's also things like discrimination that we're seeing increasing throughout society and possibly even in workplaces. What do you recommend in that area?
So definitely, we're concerned about things like ageism, xenophobia that we're seeing happening. And I think what needs to be clear is that employers really need to consider communication. Over communicate right now is better. More is better right now. There's that, common saying less is more. Well, that's not the case right now, not for this. You want to make sure, employers want to make sure that they have workplace violence and harassment policies in place, that they can make sure that they communicate that in an effective and accessible way to their employees, not just in an email attachment, but make it a point of conversation. Acknowledge that this is a challenging time, and it's, fear creates a lot of unusual circumstances and perceptions, but what can't be tolerated is those kinds of discriminations, and they're happening in workplaces, and that impacts morale, mental health, of course, the workplace culture. There's an excellent article from the Canadian Centre for Occupational Health and Safety where they really explain how workplace violence and harassment policies, education, and support will be effective and necessary to prevent this kind of stigma that might be surfacing more than ever related to COVID-19 and of course beyond. So that's definitely something. Thank you for bringing it up. That employers are asking about. That employees are afraid to return. I heard somebody at the office or at the branch or at the plant got tested and were positive. We don't have enough information. Maybe they're still sick. Maybe it's a cultural slur and perception. But those things need to be communicated with empathy. But, you want to provide the education. You want to make clear what the expectations of the organization are in terms of, tolerance for discrimination.
Yeah. And I think also making sure that people are on the watch for it, not waiting for people to come forward and report that there's been discrimination or bullying or harassment. And that it's not just looking at it among employees, like employee to employee, or within the organization, but making sure that employees are protected also from vendors or customers or members of the public, that you're really standing up for your employees and making sure that you're providing that psychological protection and that civility and respect are paramount in your workplace. And sometimes it can even just be perception. We've dealt with this in the past where there's been, because people are under heightened stress, sometimes the communications can come across as being harassment, but sometimes it is just that people are under heightened stress and not taking the time to really understand each other and communicate well.
Yeah.
So it's really important to make sure not just to communicate these are the policies and procedures and the processes, and do an investigation if something happens, but to really be watchful for the indicators that something may be happening so that you can quell those concerns before they escalate into something bigger.
Yeah. And that brings up, human rights implications that might, percolate and develop later on. This is not the time to, brush things. It's never the time to brush things, to sweep things under the rug, or to, we can't deal with that right now. We got, bigger fish to fry, or we don't want to open that can of worms. We have. So, one of the things that employers are often confused about, for example, is their duty to accommodate and their duty to address situations. Well, in a human rights perspective, from a human rights perspective, employers have the duty to inquire. If something is brought to that level, the question will be, ought they have known? What they do to address or understand and appreciate what was going on, what policies were in place. So just ignoring these situations is definitely not the way to go.
Mm-hmm. And just going down that road a little bit more, when it comes to balance or flexibility or accommodation, what should employers, what should managers be doing? What should leaders be doing to help make sure that that those employee needs are being met and it doesn't end up in this kind of a situation?
Yeah. So again, open up communication, acknowledge these are challenging times. Let your employees know who they can contact for these concerns. Make available, as more than ever, the EAP or EFAP information. We now have, a ton of government resources for counseling services, for example, that never existed before. There's Bounce Back. There's, the Big White Wall. So employers, would do well to inform themselves about what resources they have and normalize that. Send it out and say, these are hard times for all of us. I know that in our organization at AGS, we have weekly huddles where we talk about what is everyone feeling, and some people contribute, some don't, but we all have an opportunity to acknowledge our challenges, from leadership to at every level, and we talk about the resources and how to manage through this. It's not an easy time for anyone. When you're talking specifically about mental health in the workplace, for example, the Canadian Mental Health Association, and that's something so hopeful, something that I really love that I'm seeing, and I know a lot of people are feeling that way too, is there are some really great things coming out of what's happening in the world today. Organizations are coming up with incredible services and strategies and making them more readily available. So there's some really great stuff going on. And the Canadian Mental Health Association, for example, put out 6 tips for employers that, can be kind of like a roadmap that employers can follow. There are so many resources, and they talk about the tips to respond to employee anxiety and COVID-related anxiety specifically. And they talk about, their tips include things like, making sure you have a plan, communicating and sharing openly, making sure that your communications are done with empathy. And again, empathy is something that you can work on. And I think that, again, for a lot of managers, that's not something necessarily innate for them, or that they had, they needed as much in the past, although certainly very important. Communicating and sharing and openly about the worries and fears that are going on. Again, normalizing that we're all experiencing this together. Reassuring as best you can, but being realistic in that reassurance. Understanding that everyone has unique situations, because one employee is coping in their role and their situation, and maybe they have stacked tasks with elders and We don't know why it is the next employee isn't coping so well. You don't know if they've got a history of mental illness. You don't know what necessarily might be going on there. So, make it your duty to ask questions without probing into personal. Redirect them, know what your resources are and who they can be redirected to. Recognizing that really it's not business as usual right now. So those are some of the tips that I think are fantastic that were put out by the Canadian Mental Health Association and readily available. So people, really, there's so much opportunity things to prevent those situations,
Right.
becoming human rights situations, from becoming other kinds of challenges that really we have enough to deal with.
Right. And there's, a lot of organizations putting out great resources that can help guide organizations through this. And certainly the Mental Health Commission has also got their COVID hubs, so people can look there, and we'll give the information about that later. But as we're going through this time too, we're also seeing that there's a lot of other really a lot of change in the way that we're working. There's a lot more face-to-face, like meetings like this, where we're working over virtual means. There's that, peering into each other's homes, and some people are very uncomfortable with that. There's also, some people coming back to the workplace. Others have been laid off. In our discussions on this, you had mentioned something about having to be aware that there may be some resentment among workers as you're starting to move forward with things. Do you want to talk about that a little bit more?
Yeah, I think there are just so many unique situations right now. And, we need to have our ear to the ground. We need to have our finger on the pulse and really try to appreciate and maybe even consider some of the potentially percolating issues. So, maybe employers, I've heard this, have had to lay off some employees and kept others. What does that feel like for those who were laid off? What does that feel like for those who had to stay? Do they resent the ones that were laid off? Do they see the layoff as having something as having been beneficial? Do the folks who were laid off resent the fact that they weren't deemed, significant enough to stay? So, what is that? What's going to happen when you bring everyone back together? How's that going to impact the employee culture? So again, having open communications while people are away, when they're returning, having group discussions. Don't be afraid to open that can of worms. I think people really respect when leaders and managers acknowledge that there are concerns and open it up for discussion. If you don't open these things up for discussion, they will fester, and they will come out in some way or another, whether it be aggressive intercommunication between employees, or passive aggression, or just disenchantment. Employees are going, I've heard this from many people, and I know I feel strongly about this, but employees are really going to remember how their leaders and managers addressed this pandemic and the workplace and them as individuals. It's going to resonate. And when things get back to normal, what are the implications of that? Are you going to have loyal employees who respect you, are going to be confident in case there's a second wave, and we know there may be, or another situation like this in the future? Or are they going to say, I'm really not comfortable. That made me very worried about my future. And when things get better, I need to find another place to go where maybe I'll be more respected or feel more security. So, what we're doing right now, we're going to reflect back on it historically as humans. And it's also a really good opportunity and time for employers to let down the guards and really look at, human factors. Yeah.
So what you're saying is we really have to be looking at the organizational culture and how we're treating
Absolutely.
our employees, how we're treating each other, and that this is going to have definitely an ongoing effect. As we start Yeah, as we start to move through this, it can be a little bit challenging for some leaders or managers to figure out, well, what do I need to make sure that I'm addressing? Would you suggest that they should have some sort of a checklist or some guidelines on how to navigate through this?
For sure. And again, look to your resources, tap into your experts, call, I think people are more willing to share information than they've ever been. At no cost or minimal cost or just out of the goodness of their hearts. I think there is, a wanting to get through this together. But there are, for example, checklists there's one called there's one that I sent you, Liz, that you may want to put up or offer to people to check into. But basically, it talks. We know that having a restart task force is a really way to go about things. So creating that checklist of what you need in place before you reopen. Developing a communication plan for your employees and all the stakeholders. What are the precautions that are going to be taken? How are you going to address situations? If people have concerns, who can they contact? We know that operations are going to ramp up likely in a phased approach. Knowing that you communicate, having employees so that your teams and your employees know what the process will be will decrease that anxiety that comes with that potential return to business. And it won't be business as usual, not for a while, especially, with a potential second wave. So really understanding, do you have to tweak some policies and procedures, or do you just need to re-educate people on the ones that you have that do cover all of these issues? So, looking at maybe developing that restart task force and having a meeting about that and talking about all, planning for all the contingencies is going to be key.
Excellent. Excellent. So, yeah, this has been really great. I think that we've pretty much covered a lot of what we were planning to talk about today. I just want to ask you, with respect to employees who may be at greater risk, and they may be coming into the workplace and concerned that they might contract COVID-19. Workers' compensation boards are dealing with that as well and trying to figure out, how are we going to adjudicate these particular cases. Managers, HR managers, anyone who's in claims needs to be in connection not just with their workers' compensation, but also with the insurance companies and EI to figure out, what that road might look like. What would you suggest that they do, and what kind of information would you suggest that they share with employees, and how?
So again, having, sharing with employees, giving them actual scenarios, if you're feeling this way, please contact this person, but also not communicating in a way that, if this is the situation, this is what will happen, but leaving it open-ended enough, because there are going to be a lot of unique situations that people might think that they've contracted something in the workplace, but we know that the adjudicative process, at least in Ontario, they're going to really look at, is there, clear evidence that it was contracted in the workplace? So help employees to understand there are a lot of different avenues. Having your people resources in your organization who will be the ones who are out there connecting with all of these, who understand the Occupational Health and Safety Act, who understand the Workers' Safety Insurance Act, who understand having or accessing a third party, all the third parties out there for this information. I know law firms like Bernardi HR law firm is offering almost weekly free webinars for employers and HR personnel, so that these emerging new kind of situations and issues as they're emerging are being addressed, so that you can be more preventative and proactive in communicating the options and resources. So yes, employers need to be aware of all of those different potential scenarios that might arise. And employees need to understand who it is they can talk to about this. Again, if an employee is raises an issue, you need to investigate it. You need to make sure that that's done with empathy, without discrimination, that it's documented, and that then lead it down the right uh, avenue in terms of what benefit system. Is it a benefit system situation? Is it an HR issue? There's going to be a lot of, I think, mixed situations as well. Managers need to know who they can go to talk about these things, because it's a little bit outside of a lot of management scope, right? It's more of an HR issue, or it's more of a benefits issue. So, as a company, identify your resources, identify who's going to be dealing with what, and then communicate that so employees know who to go to.
Yeah, excellent. I'd like to just ask you what your thoughts are on using the national standard of Canada on psychological health and safety in the workplace to help guide employers through their response to COVID, through their, getting business back and running, and helping employees with their mental health as they go through this. What are your thoughts on that? And if you were to identify, which one of the workplace factors you think is most important, which one would it be? So two separate questions there, but I'll leave it leave it with you to answer.
So I hope I don't get sidetracked here, but more prepared employers are, managers are, they have such an important role right now, and definitely there's so many factors that speak to that. There's the factor of organizational culture, which is so important, the long-lasting implications of what employers are doing right now and how that's going to impact their organizational culture long term. What kind of psychological and social supports do your employees feel are available to them? Something we didn't talk about, recognition and reward. Those employees who are out there and who are doing a great job, or those when they're returning, this is a really good time to create a sense of hope and to really recognize employees, not just who are going above and beyond, but who are, managing through this difficult time. So psychological protection, that factor speaks to me loud and clear through all of this as well. So I think, these factors and the standard, again, can be a roadmap for employers right now. Everything we've talked about relates back to one of the factors. Mm-hmm. If employers start, if nothing more, they start by looking at the factors and the standard, and then, assessing and maybe surveying their employees, engaging their stakeholders, and starting to look at all of the factors, they will realize that, that can really be their roadmap to developing the policies and the practices and the communications that they need to be able to lead in this difficult time.
Excellent. Excellent. And because the standard is a management system, it's able to provide that guidance on how to pull it all together.
Yeah. I see it as a roadmap. Yeah.
Oh, awesome. Excellent. Well, Martine, I'd really love to thank you for your time and effort
pleasure.
Today, and sharing your wealth of knowledge and what you're seeing out there, and really some excellent advice for people who are in leadership positions, who are in managerial roles, to be able to help their employees to improve their mental health or maintain their mental health as we try and get our businesses back on track. So thank you so much.
Oh, it's my pleasure. My pleasure, Liz. It doesn't have to be all grim right now. There's so many hopeful things happening. And, I read about, post-traumatic growth. It doesn't have to be post-traumatic stress. It could be post-traumatic growth. We can all grow.
Absolutely.
If we have the right support and we have the right resources and the right communications, we can all grow from this as a society, as organizations, as people.
Excellent. Yes. So just as we finish up here, I just want to summarize that, really supporting physical and mental health of workers, it does support an organization's success. And it's not just in the immediate, it's in the long term, as we've heard from Martine. Really being prepared, have a plan, have a checklist, have a look at your procedures, your policies, see what you need to tweak, what education you might need to give to employees, and above all, be empathetic. Really assess the risk of the risk of harm to workers and what their needs are. And that's going to take a lot of open communication and just taking the time to really understand what do they need and what are the resources that we can provide, not only within our organization, but within the community. Be flexible and accommodating, because we are not in normal times right now. And when we're going through a lot of change and uncertainty, and certainly going through this time of a pandemic, that flexibility and accommodation for people who may be at higher risk is going to be so important. And that will really help, especially when you're having, more one-on-one conversations with your employees. And if you're not able to have those one-on-one conversations, then there are people like Martine out there across the country who can help to have those kinds of discussions. There are disability management specialists. There are people who do this kind of work day in and day out, and they help to smooth that road for employees as well as employers. And certainly, use the national standard for guidance, because it does identify what those workplace factors are, what they look like when you have them in place, as well as the full management system of, how you actually do it. So it's not just looking at the workplace factors, but it's looking at things like your communication plan, things like what you need to do in a situation of, a critical event where you're having to respond and bring people back into the workplace. So, get this thing to go forward. So, when when you're out there looking for resources, please check out the Mental Health Commission Resource Hub. We have a lot of resources available for you there, as well as links to external resources that other organizations have been so diligently putting out there. So definitely make sure and check that out. So you can literally type in MHCC Resource Hub and it will pop up, and you'll see that there are links to lots of different resources. And certainly if you have any questions, here is our contact information, and we'd love to be able to answer your questions. Feel free to send us an email or give us a call. And again, I just love to thank you, Martine, and wish you a wonderful day.
Thank you. Thank you so much for the opportunity.